Hi there. My name's Anne Marie, and I'm a licensed independent agent here at John Boyd and Associates in Utica, Michigan. Today, we're going to be talking all about Medicare. Today, we're going to answer a lot of questions. We're going to find out what is Medicare? Who is eligible for Medicare? Do I need to enroll in Medicare now that I'm turning 65? How do you enroll in Medicare? When do you enroll in Medicare? The parts of Medicare, how much Medicare costs, how you pay for your Medicare, what is Part D of Medicare, the 2025 Medicare prescription drug changes, what does original Medicare cover, Medicare supplements, also called Medigap plans, what is Part C of Medicare, and also Medicare Advantage plans with prescription drug coverage. So let's get started and talk about Medicare. But what exactly is Medicare? Medicare is a government-sponsored health insurance program. Medicare is a federal program available across the United States. Originally, Medicare was mainly for people age 65 and older, and it was established in 1965 to make sure that seniors had access to affordable health care. But it's not just for seniors anymore. Now, if you're under 65 and have certain disabilities or conditions like end-stage renal disease or Lou Gehrig's disease, you may also qualify. So who is eligible for Medicare? In order to be eligible for Medicare, you must be age 65 or older, be a U.S. resident, and be either a U.S. citizen or an alien who has been lawfully admitted for permanent residence and has been residing in the United States for 5 continuous years prior to the month of filing for the application for Medicare. Do I need to enroll in Medicare now that I'm turning 65, or should I wait? If you're still working or covered under your spouse's plan and that coverage is considered credible by Medicare, you can stick with it. Credible coverage means that your plan is as good or better than what Medicare offers, which prevents you from facing penalties for delaying Medicare enrollment. The second option is if you don't have credible coverage through an employer or spouse, you should sign up for Medicare to avoid the late enrollment penalties and potential gaps in coverage. So, to confirm whether your employer's group plan qualifies as credible coverage, you should check with your Human Resources department. They should be able to verify if your plan meets Medicare's standards for credible coverage. If it doesn't, you'll want to enroll in Medicare to avoid penalties. So, you're turning 65 or you're new to Medicare. How do you enroll? There are 2 ways that you can be enrolled into Medicare. The first way is automatic enrollment. If you're already receiving Social Security benefits, at least 4 months before you turn 65, you will be automatically enrolled in Medicare Part A and Part B. You'll receive your Medicare card in the mail about 3 months before your 65th birthday. The second way is manual enrollment. If you are not receiving your Social Security benefits, you will need to manually sign up for Medicare. You can do this in 3 ways. The first is online by visiting the Social Security website and following the instructions to apply for Medicare. The second way is by phone, calling Social Security, and I've included the phone number on the screen. And 3 is in person by visiting your local Social Security office. It's probably a good idea to call ahead and make an appointment. When do I enroll in Medicare? Medicare has several different enrollment periods that allow you to sign up for or make changes to your Medicare. Let's focus on the initial enrollment period, which is when most people first sign up for Medicare. This period is crucial because it's your first opportunity to get Medicare when you're turning 65 or are new to Medicare for other reasons. The initial enrollment period is a 7-month period that begins when you're turning 65. So the enrollment period includes the 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. If you did not enroll during your initial enrollment period because you are still employed and have group coverage either through your employer or your spouse's, and you are now retiring or losing that group coverage, this opens you up for a special enrollment period for you to enroll in Part A and Part B of Medicare. So now we are going to go over the parts of Medicare. And I think for a lot of people, this is where it gets a little confusing. So I'm hoping we're going to take this one step at a time and so you can understand this. Medicare is divided into 4 parts: Part A, Part B, Part C, and Part D. Each part covers different areas of healthcare, and it's important to understand what each part does. So we're going to start with Medicare Part A. And Part A is also called hospital insurance. And what it's covering is inpatient care in the hospital, skilled nursing facility, hospice care, and some home health care. Part B is also called medical insurance. And what it is helping to cover is services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment, and many preventative services like screenings, shots or vaccines, and yearly wellness visits. Now that we've finished covering what Part A and Part B is, I want to just let you know that Part A and Part B is what is considered original Medicare. So if you're talking to somebody or an agent asks, do you have original Medicare? All they're asking you is if you are signed up for your Part A or Part B of Medicare. So how much does Part A and Part B of Medicare cost? Because I know I speak to a lot of people and they're under the impression that they will pay absolutely nothing for their Medicare, and that's not true. So for Part A, if you've worked approximately 10 years and earned your 40 quarters of coverage, then you will be eligible for premium-free Part A, which means you'll pay nothing for your Part A of Medicare. If you aren't eligible for the premium-free Part A, you may be able to buy it. If you buy Part A, you'll pay a premium of either $278 or up to $505 each month in 2024, depending on how long you or your spouse worked and paid Medicare taxes. To be enrolled in Part B, you must pay a monthly premium. In 2024, the standard Part B premium is $174.70 per month, but this can vary depending on your income level. So the standard premium is what most people will pay if their income is below certain thresholds. But if your income is higher, you may pay more than the standard amount due to the income related monthly adjustment amount, or IRMA. IRMA is an additional charge added to your Part B and D premiums if your modified adjusted gross income exceeds certain levels. This adjustment ensures that higher income beneficiaries contribute more to the Medicare program. The Social Security Administration determines if you owe IRMA based on your income from 2 years ago. So if you're getting your Medicare started in 2024, they're going to be looking at your tax returns from 2022. So for 2024, if your 2022 Modified adjusted gross income is above $103,000 if you filed individually, or $206,000 if you're married and filing jointly, you may pay IRMA. So now we've learned about the cost of Part A and Part B. So how do we pay for our Medicare? If you're receiving Social Security benefits, your Part B premium is going to be automatically deducted from your Social Security check. So they take it right off the top. If you are not collecting Social Security yet, then Medicare is going to bill you quarterly for that Part B premium. So every 3 months, they will send you a bill, and you will have a couple different options of how you want to pay that bill. So you can set up a Medicare.gov account. You can pay it right online. You can pay directly from your savings or checking account through your bank's online bill payment services. You can sign up for Medicare Easy Pay, or you can mail your payments into Medicare. So I know these are out of order. We've covered Part A and Part B, so you would think naturally Part C comes next, but I'm actually going to cover Part D. What is Part D of Medicare? Medicare Part D is the prescription drug coverage component of Medicare. It helps cover the costs of prescription medications and is available to everyone with Medicare. So, what does Medicare Part D cover? It primarily covers a wide range of prescription medications, including both generic and brand name drugs. Each Medicare Part D plan has a formulary, which is a list of covered drugs. These are divided into tiers, with drugs in the lower tiers generally costing less. If a medication is not listed on the plan's formulary, it may not be covered unless an exception is granted. So, what is the cost of Medicare Part D? Most people pay a monthly premium for Part D. Some plans have a deductible that must be met first before the plan starts paying. After meeting the deductible, you'll generally pay either a copayment, which is a fixed amount, or a coinsurance, which is a percentage of the cost for your prescriptions. Moving into 2025, there are changes to Medicare, specifically in regards to the prescription drug plans. So, in this section, we're going to take a look at what's new, how these changes can benefit you, and what you can do to prepare for 2025. From 2024 to 2025, there are significant changes to the Medicare Part D prescription drug plans driven by the Inflation Reduction Act. So, the first thing that's changing is starting in 2025, the coverage gap, which is often called the donut hole, will be eliminated from the Medicare Part D. And so instead of having 4 phases as it is right now in 2024, in 2025, it will only have 3 phases: the deductible stage, the initial coverage stage, the catastrophic coverage stage. 2 is the out of pocket maximum for prescription drugs will drop significantly from $8,000 in 2024 to $2,000 in 2025. After reaching this cap, Medicare users will no longer have to pay for covered prescription drugs for the rest of the year. And 3, a new Medicare prescription payment plan will allow beneficiaries to spread out their out of pocket costs into monthly payments rather than paying them all at once when filling prescriptions. The optional plan provides financial flexibility but does not reduce the overall cost. Another thing is, if you have a $20 copayment, it makes no sense to spread that over 12 months because in the long run, it will cost you more to pick up your prescriptions at the end of the year because you're compounding that amount. This is for people who have a significant amount of copay or coinsurance at the beginning of the year, typically above $600. So it allows them to spread that $600 over 12 months. So now we've made it to the part that I'm sure all of you are looking forward to. We've covered what your Part A does. We know now what our Part B does. We've also covered our Part D. So we know that Part A and Part B is your original Medicare. So you're probably asking, why do we need anything further? Why don't we just stay on original Medicare? So in this section, I'm going to explain to you, what does original Medicare cover? While original Medicare offers comprehensive coverage for many healthcare services, there are some key limitations that can create financial and coverage gaps when staying on just original Medicare. So, typically, when you're on original Medicare, Medicare is going to cover approximately 80%, leaving you with 20%. And so, while that does not sound like that much, there's a couple reasons why people choose to add additional coverage when they are on just original Medicare. So, here's a few reasons. The first one is that original Medicare has no out of pocket maximum, which means that there is no limit to how much you could be responsible for paying in healthcare costs in a given year. So, if you need a lot of care or you have a particularly serious illness or extended hospital stay, your out of pocket expenses can become quite substantial. Original Medicare does not have any prescription drug coverage. So, without a Part D plan, you'd be responsible for 100% of the cost for any prescription drugs, which can quickly become expensive, especially for long term or costly medications. Original Medicare has limited coverage for vision, dental, and hearing. So you would need to pay out of pocket for any eye exams, glasses, dental cleanings, fillings, dentures, or hearing aids unless you purchase a separate plan that covers these services. Original Medicare has lack of coverage for long-term care. So if you need long-term care, which many seniors eventually do, you would need to pay out of pocket or rely on Medicaid if you qualify, or purchase a long-term care insurance to cover those costs. Because of these reasons, many people opt to supplement their original Medicare with a Medicare Advantage plan, a Part D plan, or a Medigap policy to reduce these gaps and protect themselves from large, unpredictable healthcare costs. So I'm going to explain to you what those two options look like because they're completely different. So I'm going to start with a Medicare supplement. They are also called a Medigap plan. So if you talk to somebody, and I know I am good for it, sometimes I'll say Medicare supplement, other times I'll say Medigap plan. It is the two different words that mean the same exact product. So, a Medicare supplement is designed to help cover the gaps in original Medicare. So, you're keeping your original Medicare, your parts A and B, and then you're adding on this Medicare supplement that is going to fill in the gaps. And there are different variations of Medicare supplements, and they are have plan names that are indicated by letters. So the most common Medicare supplements right now is the Plan G and the Plan N. So what you need to know about a Medicare supplement is that they are federally regulated. So regardless of which insurance company you go with, if you pick a Plan G, it is going to be the exact same with each insurance carrier. So a Plan G with Blue Cross is going to be the same as Priority Health, as the same as HAP. The only difference is going to be the monthly premium. With a Medicare supplement, it does not come with a prescription drug plan. So you would have to add a prescription drug plan on, and it does not come with dental or vision. So if you needed those services, you would also need to add on a standalone dental plan or a standalone vision plan or both. With a Medicare supplement, there are no networks. So you're going to have nationwide access to providers. So as long as you are going to a doctor that accepts original Medicare, your supplement will be accepted. Another reason is it's guaranteed renewable. So you're going to have ongoing coverage as long as you pay your premiums. Your Medigap policy cannot be canceled, which provides you with long-term security. So there's no referrals required. Medigaps do not require referrals to see a specialist, which allows for direct access to healthcare services. Medigap plans typically have a fixed monthly premium, which can make budgeting easier because you know what's going to be deducted out of your checking or savings account every month. So, depending on the plan that you selected, your out of pocket costs can be minimal. You can keep your Medigap policy even if you move to another state, ensuring continuity of coverage regardless of your location. Medigap plans are designed to work seamlessly with Medicare, which simplifies the billing process. Your provider will bill Medicare first, and then whatever is not covered by Medicare will be billed to your Medicare supplement, and they will pay the remainder. Another thing with a Medicare supplement is when you are first aging into Medicare or the first time that you are getting your Medicare, you have a period that you can automatically join a Medicare supplement without any underwriting, which means that they're not going to ask you any medical questions at all, and they're just going to accept you onto a Medicare supplement. In summary, a Medicare supplement plan provides comprehensive coverage, flexibility, and peace of mind by reducing out of pocket expenses and offering predictable healthcare costs. It's especially beneficial for those who value having a broad access to healthcare providers without any network restrictions. So, now I'd like to discuss a little bit about a Medicare Advantage plan. Medicare Advantage plans are also known as Part C. So when you hear Part C, you know that people are referring to a Medicare Advantage plan. The Medicare Advantage plans are completely different than the Medicare supplements. So, Medicare supplements, I told you they are more like a la carte. With a Medicare Advantage plan, they are a bundled plan. So, what's happening with these is um, you're going to have your original Medicare, and so your Medicare Advantage plan is going to cover everything that your Part A and B covers, but an insurance company is going to be managing your healthcare. So, with a Medicare Advantage plan, these are completely different and they're more like you're probably more typically used to. So, you're going to have a network. So, with these, you are going to want to make sure that any doctors that you're seeing are in network with whatever plan that you are possibly going with. They are bundled. So when I say bundled, they are going to include your medical coverage, your prescription drug coverage, dental, vision, hearing, over the counter benefits, a gym membership. And so they're going to all be included in this plan. A lot of the Medicare Advantage plans are $0 premium, so you don't pay anything to have the plan. How these work is that you will have a set amount of a copay or co-insurance based on what medical need you have. And so these are set up in the summary and benefits before you even sign up for a plan. It'll tell you if you go see your primary care doctor, it will be a $0 copay. If you go see a specialist, it may be a $35 or a $45 copay. And so you're going to want to look at different plan options and look at the different co-insurances and co-payments and decide which one is going to be the best fit for you. With Medicare Advantage plans, these do change every year. So your independent agent is going to reach out to you during open enrollment time, which is October 15th through December 7th. And your agent is going to ask you, are you seeing any new doctors? Are you on any new medications? Because you're going to shop for new plans for the upcoming year, which is kind of what we're doing right now. So the new plans for 2025 are going to be coming out. And so by you sending us your information, we are going to look through all the different plans that we work with to see which one is going to cover your doctors, your medications, the best that we can get them to be covered. With the Medicare Advantage plan, it does have a max out of pocket. So you're going to know right up front that, say, the worst case scenario, if you had the worst year of your life, the most that you will pay out of pocket is, for example, a max out of pocket $4,300. That is the most that you will spend out of pocket. And if you get to that point, you will not pay anything over that. With the Medicare Advantage plan, you sometimes will need a referral. And you also, in order to get some tests and procedures done, you may have to get authorization. Many of the Medicare Advantage plans do offer coverage for emergency and urgent care services when traveling outside of the United States, which provides peace of mind during travel. So, in summary, a Medicare Advantage plan with prescription drug coverage offers comprehensive healthcare benefits, including additional services that are not covered by original Medicare. They are lower out of pocket costs and coordinated care. So, these features make it an attractive option for those seeking a more all inclusive approach in their Medicare coverage. So, having the right insurance coverage can make a huge difference in what is covered and how much you're paying out of pocket for your plan and your medications. So, working with a trusted advisor is so important. So, on the screen here, I just wanted to give you some uh, reasons of why it's so important and valuable to work with an independent agent. And so, one, as an independent agent, we work with a multiple of insurance carriers. So, we're not just looking at one insurance carrier and having to go with one of those. We are looking at several insurance companies and hundreds of plans to see which one is going to be the best for you. Two, we are talking to you. We're getting to know you and your situation so we can best put you in a plan that is going to work with all of your needs and help cover all your medications the best that they can be covered. Three, we are the experts in the insurance world. So, working with us, you're saving time and stress that you don't need to worry about by contacting somebody who does this every day. Four, we're going to help you compare plans, not just with one company, with many different carriers to see which one's going to be best for your needs. Five, we're your advocate. So we are going to do what's the best for you. We don't work for the insurance companies, we work for you, the client. So we want to make sure that you are taken care of. Six, the best part of this is completely free. We never charge our clients and we never charge for any of our services or our expertise. We get compensated from the insurance carriers, so we don't care what plan you go with. We are just making sure that we are doing the best for our clients because we work for you. If you know anyone on Medicare who takes prescription drugs, feel free to share this information with them. We want to make sure no one is caught off guard in January if their medications are no longer covered. If you don't already have a trusted advisor, John Boyd and Associates is here to help. We'd be more than happy to review your current coverage, make sure your medications are on formulary, and find the best coverage options for your needs. Thank you for your time, and please feel free to reach out if you have any questions or need assistance. We are here to help you navigate these changes and find the best Medicare plans for your needs. We look forward to working with you and have a great day.